Catton joins us from Geneva. He's the CEO of International Council of Nurses. Welcome to the programme. Great to have you on for this story. Just for our international audience, remind us why so many nurses in England, Wales and Northern Ireland are on strike.
It's good to be with you. So this is historic and unprecedented for nurses to take strike action across the UK. But we are seeing this phenomena globally. Since the summer, we have seen an increase in strikes and disputes by nurses and health workers around the world. And there are a few things going on here. Firstly, historically, we have undervalued the contribution of nurses. We talk about care, we talk about vocation, but it's almost become an excuse for poor pay. We then saw in the COVID pandemic the absolute true value and worth of all of our healthcare workers. They held our communities, our societies together. We applauded them, but no action. And that action is resulting in the anger and the disputes and the action that you are seeing happening across the world now. And importantly, what all of these healthcare workers are also saying, this is an issue about patient safety. We have not got enough nurses, enough staff to keep our health systems safe.
Absolutely. Patient safety is so important. And of course, that they do such an incredible job. I could speak about this for hours, but just very quickly, Howard, what has the government's response been? I see that it doesn't seem that it wants to budge from that 4% pay rise. What do you think they'll do?
We've written to the government because they're just not prepared to talk about pay, and they seem to be saying that they can't afford to pay nurses more. What we say is that you can't afford not to. We've seen the contribution of nurses to our health safety, our health security, our health systems. But, you know, I think there is a really strong economic case for investing in nurses and in healthcare. They keep people safe, they keep people working. Think of the millions who are spending on agency staff if we don't have these nurses. Our health industries, they drive research and innovation. The road to economic growth is paved with investment in health. And do you know, this pandemic has cost the world trillions.
Absolutely.
It's eye-watering, the sums that have been spent. Could be up to nearly half of the global GDP. So even if you don't accept the moral case, the social case for investing in nurses, look at the hard economics and put your money in a surefire investment in all of our safety and security, nurses and healthcare workers.
Indeed, and as you say, you can't afford not to. It's incredible. It really is. What happens next then? Because will they strike again? Because this is also going to coincide, isn't it, with ambulance workers possibly striking too? Is that correct?
Look, there are a series of strikes that are taking place across the UK at the moment. The Royal College of Nursing has said, talk to us. We won't dig in. We're prepared to have negotiations. The public support and sympathy is on the side of nurses and healthcare
and Howard,
workers
just very
at the
quickly,
moment.
there is money in the system, isn't there?
Of course there is money in the system, because this is about choices. It's always about political choices, and they could bring it forward now. And the other irony, this is a government who says we're driven by free market forces, by supply and demand. There is 50,000 nursing vacancies in the UK. There are up to 10 million nurses that we need to find to address a global shortage. If you want to recruit and retain, and not, as the UK have been doing, the morally dubious practice of filling vacancies by going overseas to countries who are less able to lose their nurses, again, look at the economics, look at those principles, invest in nursing.
Howard, thank you very much indeed. And as you say, they have the public's support. Thank you so much for speaking to us on this story. Thank you.